Welcome everybody to our September 2022 Community Collaborative Resource Sharing Meeting. It's great to see you all, and I hope you all had an enjoyable 3-day weekend. A reminder that we are providing interpretation at the meeting today from English into Spanish, so thank you, Sandra, for being with us today. And just a reminder how to enable the interpretation. If you go to the bottom ribbon on your Zoom screen and click on the interpretation button, it's a little globe, and then you can click the language that you would like to hear the meeting in. And if you'd like to hear Spanish, Sandra will be interpreting for us today. So thank you, Christina. And just a reminder to ensure that our interpretation goes as smoothly as possible. If you are speaking, please pause between sentences or complete thoughts to allow Sandra time to catch up. And in the main broadcast channel, we can hear everybody except for Sandra. Again, join the channel of your language preference. And we are offering live transcription. So you can go to the bottom ribbon again and click on, sorry, mine is on, so I can't click on show captions. However, it only supports English. So you will see the transcription in English. And I would say for our presenters today too, a little tip I've learned from Sandra and Christina, if I watch Sandra, I can tell when she's caught up. And that's how I know when to pause. So thank you, Sandra. Next slide. So a couple housekeeping pieces. If you could go ahead and complete our demographic form. Many of you know that we are supported by First 5 Nevada County and First 5 Placer County, of which we are very grateful. And we do need to collect very basic demographic information. So there is a link on this slide. If you click on the link, please go ahead and fill out the demographic form. We really appreciate that. And Christine, I can just go ahead to the next slide if you want to stay on that slide, if it gives people another minute. Just a reminder, our collaborative is a program of the Tahoe Truckee Community Foundation. We are comprised of 46 family strengthening, health, education, and social service agencies who really work together to address the fundamental needs of our local residents in the Tahoe Truckee area. The next slide is a list of our partner organizations. And we do a number of things as a collaborative. As a reminder, we convene our partners on a regular basis. We support communication amongst our partners through a twice-a-month bulletin, through a Facebook page, which we are working on developing and building. We also collect and measure data in the areas of health, education, and economic well-being. We advocate for the needs of our local community members as well as our partner organizations. And then we focus on capacity building through various trainings and leadership development opportunities. So for our agenda today, we are going to momentarily try out a new technology. So I will preface it with that we ask you all for a little bit of patience, and I'll talk more about it in a minute. And then we're going to launch into our resource sharing, which is really an opportunity for you all to share program updates, anything happening at your organization that you would like the rest of the collaborative to know about. We're going to take a short break, and then we're going to hear 2 updates from community partners. Really one of the roles of this meeting, or the goals, is to provide opportunities for our partners to network, but also share updates and information from our key partners in the community and ensure that as a collaborative, we are up to date on what's happening and ensure that we can be as responsive as possible as a collaborative to whatever's happening in the community, and that you can as individual partners as well. So with that, we are thrilled that Tahoe Forest Hospital is here with us today to share the results and the findings of their recent community health needs assessment. It's chock full of really good data, which I'm excited to for you all to have eyes on. And then Connecting Point is also here to give an update on their resource 211, which is really our main resource and referral information kind of channel and platform that we use as a partnership. So thank you to both our partners in the hospital and Connecting Point for being here today. So next slide, please, Christina. Okay, so before we get going, I just wanted to quickly go through our meeting guidelines that we adopted last year from the Annie E. Casey Foundation. So our meeting guidelines are: bring your best self, be an active listener, be kind and generous, stay engaged, be open and suspend judgment, speak your truth, lean into discomfort, enable empathy and compassion, expect and accept that there might not be closure. Thank you, Christina. Okay, so before I turn it over to Christina, I just want to read a quote from CHNA. So networking is not about just connecting people. It's about connecting people with people with ideas, and people with opportunities. And so before I turn it over to Christina, I just want to reiterate that we are trying a newish technology today. We've talked a lot as a collaborative about when is the right time to convene in person. And we recognize that this meeting in particular, because it's open to our entire partnership, and many of our partners are based either in Western Placer County, Western Nevada County, some in Reno, that there is definitely a benefit to convening virtually. And we are working towards determining if we can have an in-person convening before the snow flies. And since we're committed to meeting virtually in this format for now, we've been experimenting with different virtual technologies to support our work as a collaborative and to support our networking and to support our collaboration. And so this is a pilot today. Thank you all for participating in our pilot. And Christina, I'm going to turn it over to you, and thank you, Christina, for all your hard work trying to figure this out. So thanks.
Sorry, I have too many things open and so I couldn't find them on mute. Okay, so as Allison said, we are going to try a new app for Zoom. It's called Twine. If you joined us at our January resource sharing meeting, we did speed networking through an app called Glimpse. This is Glimpse. It was bought by Twine and is now integrated into Zoom. So there's a couple things that we'll need to do in order for us to get the most experience out of the app. And one of that is to download it. But I also need to know if anyone is joining us from two devices. So if you're on your phone and your computer, I need to exclude one of your devices so that you're not paired one-on-one and somebody's in an empty room. So Lizzie, you're on two. Lizzie, is it
my audio is on no, I think they're both my name.
Okay. I only see one for you for some reason.
Oh, wellness neighborhood, or it's like a picture of a fruit basket.
So wellness neighborhood is not being used by you. Oh no, I see it. It's Elizabeth Hennessy. So Lizzie is the one where your audio is coming from that you're actually a part of. Okay, so
yeah, and I can hang
Elizabeth. Okay, great. So all that means is that way Elizabeth isn't matched with somebody and somebody's in an empty room. Is there anybody else who's on two different devices? Okay, great. Thank you. Okay, and then if you're on a mobile device, it also you're not able to download the app from a mobile device. And so just hang tight with us if you're on a mobile device. And again, you'll still be able to be in the speed networking. It's just a little bit different process. Okay, so I'm going to invite you, if you haven't already had a chance to try and download the app, I'm going to invite you. You should have a pop-up window that looks like this. And you just open and it'll walk you through how to download it. If you don't get this pop-up window, it's because you're not logged in as yourself in Zoom, or it may be because you haven't downloaded the desktop client. And so you'll need to have both of those things already enabled in order to see this pop-up. So we're just going to allow people just like a minute or two to try this. Just because, as Allison said, we're planning to be in virtual for a while. And so if we do have everyone in this app, it's a better user experience. Oh, and I can see that some people are getting it to work. So that's great. Thank you. And again, if you're not able to get it to work, it's okay. I did send an email out on Saturday, so I apologize for the last minuteness of it, but I'll send it out again after this meeting with the app. And so if you want to try and download it after this meeting, that works as well. And if you're also having issues getting into the app, it may be because your administrator needs to approve it for you. So again, we can try again later. And once you're, oh, Kimberly, I see you, you're in. And then once you do download it, you'll be asked to sign in again, and it may make you sign in a different pop-up window. So you may need to minimize your Zoom window and look and see if there's any new pop-up windows, and then just sign in there, and then you should be able to get it. But this is exciting. I'm seeing actually almost half of the room, more than half of the room is in it. Thanks, Allison. Thank you, everyone. Again, just thank you for your patience in this. It's going to be awesome when we get everyone in it. So. Okay, well then with that, maybe I'll just give like 15 more seconds for people to, okay.
Yeah, take your time. People can stand up, have a stretch, look out a window.
So what's really cool about this is that we can do tag-based matching, which I guess I can move to the next screen to show you, but we're only able to do it if you're in the app. And the other thing that's really cool about this is if we wanted to do breakout rooms, you actually see a map of the rooms, and you're able to, as if you're in person, like go to the table that you want to join, and then you can swap tables if you want. And there's also some functionality for the hosts. We can actually share a screen to the breakout rooms, which we weren't able to do before in just the normal breakouts. We can also talk to you. We can broadcast a message to you in the breakout room. And broadcast messages to you. So it just gives us a little bit more functionality that we didn't have before. And if anyone wants to try it later after this meeting, I'm happy to help anyone. Okay. So I'm going to have to do a few manual matchings because not everyone's in the app. So I am aware of who our Spanish speakers are, but I'm not aware of who all our bilingual speakers are. And so what we wanted to do now in our icebreaker is to match you guys one-on-one for 3 minutes. And so I'd like to be able to pair our Spanish speakers with some of our bilingual speakers. So if you could, please just rename yourself and put either a B if you're bilingual or an S if you're a Spanish speaker, so that I manually can match you with someone who speaks your language. Because once I hit shuffle, it'll be a random shuffle. And so because of that, some of you, I may bounce you out of a room really quick to join a different room so that I can make those pairings based on language. So I think we're doing pretty good on time. So I think we'll do 3 rounds, Allison, of 3 minutes each. Okay.
That sounds great.
Okay, so I have to exclude you guys before I can start this. Hold on, sorry. Okay. Okay, so I think this is how it works. I'm not exactly sure. but you may now see a screen that allows you to pick a tag. And if you don't, you will as soon as I start it. But what we'd like you to do is to select your tag if you're able to download the map, and say if you're an English speaker or a Spanish speaker, and then to match with a speaker that you'll understand. So if you're English and you only speak English, you'll say I am English, and I want to be matched with an English speaker. If you're bilingual, you'll say I am English, Spanish, match me with an English, Spanish speaker. And if you're a Spanish speaker, you can say I am Spanish, match me with a Spanish speaker. And so we'll begin matching. If you do have the app downloaded, you'll see a timer that lets you know 3 minutes. If you weren't able to download the map, you'll not be able to see the timer. And so I will broadcast a message for you when we are 30 seconds up. Again, there might be a little bit of bouncing between rooms because I need to move you quick so that we can have people in breakout rooms that, oh, good. I can see you guys are selecting tags. That's awesome. Oh, okay. This is so exciting. All right. So thanks so much for helping me with this. Allison, go ahead.
Natalie is just asking if you can send the link
to the app.
Yes, she just came in late.
Oh, sure. So it looks like I can just send it to you, Natalie. There we go. So it should have just sent to you. Okay. All right. Let me just put these. Sorry that this is so slow. Okay. So we're going to start matchmaking. This first one will be a little bit not so smooth.
And then Christina said,
yeah.
Oh, sorry. There's a question about what the icebreaker questions are.
Yeah, thank you for that. So if you would like an icebreaker, it's optional. You can just use this time to catch up. Make sure you say your name, your organization, your role with your organization, and anything else that you would like to have the other person know about you. But if you'd like an icebreaker question.
Do you want me to put them in the?
Yeah, here we go.
Okay. Cool.
Here are the questions, and I think I can share my screen, although that might be kind of distracting when you're in your one-on-one, but I can also share there.
Okay.
Okay, so we're gonna try this out. All right, here we go. Start matchmaking. Definitely a little clunky and a little glitchy, but I've learned some things through that test run. So thank you all for being our guinea pigs on that. And if we do it again, having more people in the app will definitely help. And so I appreciate everyone taking the time to download the app. I'm going to turn it over to you, Allison.
Okay. My experience, Christina, was great. Thank you very much. I really enjoyed the folks I got to chat with. So thank you for introducing us to that. And, really one of our goals of bringing technology to you all is that you're also able to bring it back to your own organizations. And conversely, if you have technology that's worked well for you in virtual settings at your organization, we would love to hear about it. So thank you again, Christina. And at the end, we do share an evaluation form. So please, I love that you're putting comments in the chat box, and please also record them in the evaluation form as well. So thank you, Christina. Okay, so we are going, everybody. So at this point, I would like to welcome Lizzie Hennessy, who works with Tahoe Forest Hospital, who is a population health analyst, and she is going to share the findings from the most recent community needs assessment. And just a reminder, one of our roles as a collaborative and one of our goals is to really be a data and story driven collaborative, to really use data to help inform our work as a partnership, to use data to help inform our work as individual organizations. And one of the data sources that we rely very heavily upon is the community health needs assessment. So thank you, Lizzie, for your time today and sharing the information with us.
Great, thank you for having me. Do I need to give a moment?
Sorry, I just want to make sure there'll be 2 slide decks being shown, one in English and one in Spanish. So I just want to make sure everyone knows how to do Spanish. I haven't started sharing it yet, but as soon as I do, you'll go to view options and then, it's actually going to say Spanish recording instead of ver diapositivas en español.
And then Lucy, I will just say one more thing, and I apologize for the very transparent facilitation, but I often will pin Sandra so I can see when she's done. Okay, cool.
I don't know how to do that. Let me see. Pin. All right.
Yeah.
Oh, now I can't see the slides.
Okay, so they don't work.
Okay. Can I go ahead? I can't see my slides.
Sorry,
may
can
have-
you not see what I'm
I
sharing?
just see Sandra.
Okay, so you may
I'm
have to
just going to
unpin
not
her.
pin her.
Yeah.
Okay.
Okay.
Well, thank you
good.
for having me today. I'm going to spend about the next 25 minutes talking about our 2021 Community Health Needs Assessment. I am with the Wellness Neighborhood of Tahoe Forest Health System. And as we are a department funded by taxpayer money and community money, we use those funds to identify community health needs and developing programming to address those needs. Next slide, please. What I'll be talking about today is the 4th community health needs assessment that we have completed thus far. This was originally a requirement of the Affordable Care Act. The nonprofit hospitals conduct a community health needs assessment and then create a community health improvement plan using the findings of that assessment. This helps us be accountable and responsive to what we know are our local needs. Thank you. So since 2011, we have been using standardized questions to conduct a survey of a randomized sample. We use the Behavioral Risk Factor Surveillance Survey, and these allow us to compare at the state level and at the national level. This is when we know when we are well beyond what our peers in other states or communities with their rates are. This time around, we did 2 different sample methodologies. We did a randomized sample using an address-based methodology. So if you have a zip code within the Tahoe Forest Health System service area, you had equal opportunity to be chosen in the randomized sample. We captured 432 adults. I'm trying to look for Sandra here. Or households, I should say, with our randomized sample. We only survey adults, so you have to be 18 years of age or older. And our time frame was back in May of 2021. So we are a ways out now. We did a mailing towards the end of May with a postcard that was bilingual, and households that were chosen could call our surveyor. It was a Center for Opinion Research with Franklin and Marshall College. Or they could go on a website and complete the survey, or they could wait to be called. So you can see the outbound calls went out between May and July. After the randomized survey was closed, we did a targeted survey with groups of people that historically have been low respondents in our randomized sample. We know this because this is our 4th survey, and in the previous surveys, we've been able to target those groups with in-person focus groups. However, as you know, in 2021, that would have proven challenging due to physical distancing requirements and COVID concerns. So this time around, we partnered with Sierra Community House and their food distribution and Promotora home visiting program to survey socioeconomically disadvantaged adults. Our low responding groups tend to be young adults, ages 18 to 24, our Spanish speaking population, and our unhoused. Because as I said, we use an address-based methodology, so we're just not going to capture unhoused without trying to capture them. Through this methodology, we surveyed 146 adults. And those surveys could be completed also in English or Spanish. All right, next slide, Christina. This is more for some background. Basically what we do is you survey, we found our respondents, we have some of their demographics, and then we weight the survey based on our demographic profile per the census. So the red box is showing the weighted survey and what ultimately I'm going to be talking about today when I discuss percentages. But you can see on here also that when I spoke about young adults and low respondents, we only had 7.9%, even with our weighted sample, whereas ideally we would have had closer to 23%. So that's just a bias in the data that we just are transparent with. With any data surveying, there's always some sort of bias, and part of this is just being aware of what the biases are in your data capture. But as far as male, female go, pretty even. As far as education goes, okay, we could have had more respondents with a high school or education or less in some college, but overall, it's okay. This is still a really reliable survey to compare to the broader population. Okay, our findings have, since 2011, stayed within the same 4 focus areas. These are prevention and wellness, substance misuse, mental behavioral health, and chronic disease. In 2011, ethnic disparities was its own focus area. And then the next 2 surveys, it was wrapped in. And we found in 2021, we again want to pull it out and make it its own focus area just to ensure that we can highlight this as a need versus it being embedded. It is still embedded in those 4. We see health disparities in all 4 of those topics, but just to really focus on this and highlight the need, we made it its own as well. And part of the benefit of us being able to support this with data is that we had that targeted survey with Sierra Community House clients that we can compare those findings to our randomized population. All right, so now I'm going to get into the data. And where we are looking at 2017 to 2021, the graphs are blue and green. So green is 2017, blue is 2021. It's a good visual to see how we changed. Substance misuse continues to be a concern in our community. Overall, 1 in 3 residents reports elevated substance use. So you can see from the graph that our binge drinking rates increased. And not only did they increase, but compared to the California rate, as I was saying, we can compare to state and national rates because we are using the exact same question. For reference, California is 16% compared to us, we're at 28% of our community members had binge drank in the last, I think, a month is the time period we're looking at here. In addition, our smoking population has increased, our vaping has increased, and overall substance misuse has increased. I do want to point out, prescription for pain has remarkably decreased. And this is even more incredible because we have another question that falls under chronic disease, and our population experiencing chronic pain has increased. So that just makes this even more remarkable. Mental behavioral health continues to be a concern. I think we are all pretty aware of this. In this survey, we ask a multitude of mental health questions. This is a few. And I do want to point out two of our questions are, have you ever been diagnosed by a medical professional with depressive disorder? So 1 in 5 of our respondents had a diagnosis of depressive disorder. And you can see in this graph that when comparing to 2017, we increased across the board. Anxiety, good news as far as accessing counseling. Currently depressed, which is asking about the last 2 weeks. Being diagnosed with depressive disorder and just self-reporting poor mental health increased across the board. Okay, some of our chronic disease data. So here our indicators are mixed. Although I'm going to start at the end with overweight and obese. Although BMI decreased compared to 2017, it is important to note that we still have nearly 46% of our residents are overweight or obese, which yes, is better than California and nationwide, but is still something to make note of. Our residents, as I was saying, who experienced chronic pain has increased. It shows how active of a community we are, I think. And high blood pressure and high cholesterol have increased as well. Okay, prevention and wellness data. Most of our proactive positive health behaviors declined compared to 17. So I think this is kind of intuitive. Not as many people visited the dentist. Not as many people had a physical in the past year. Good news is access to flu. More people got flu vaccines, which is good. And I have some COVID data there on the right. This is, again, back in July 2021. But this shows that compared to the state, our zip codes actually had a pretty high COVID-19 vaccine rate. This is a slide where if you were to take the percentages from the randomized survey and apply them to our total population numbers using the US Census totals, around 30,000, let's say people, this is how many people are impacted by that indicator. And looking at it this way, you really see that one of our needs is 3 servings of veggies per day. The top 7 are here and are in order. So veggies is number 1, having any trauma symptoms was number 2, not enough sleep is number 3, etc. We skipped some because we wanted to highlight others. We wanted to highlight that economic hardship was experienced by around 12,000 community members in 2021. And that's an aggregate question. There's about 12 questions it asks about, such as falling behind on rent, being able to purchase food or gasoline or medical care. And so just kind of puts in perspective how many people were struggling economically and financially in 2021. And then does not have a PCP is important to highlight because a lot of Tahoe Forest services are accessed through your primary care provider. Sorry for the acronym, primary care provider. For example, mental and behavioral health services are accessed through your primary care provider. And then substance misuse and binge drinking, just for some reference about how many people we're talking about there too. You can go to the next one, Christina. Okay, so as I was saying, because we use the same questions, we can compare our SED, our socioeconomically disadvantaged respondents, to our randomized sample. This is an old graph. We've changed our wording, but this was created a year and a half ago by a consultant. So just so you know, that's why it says adults and low income. I will likely use the terms randomized and SED. So randomized is blue, SED is purple, and our final reports, these will be corrected. What is remarkable here, though, is when looking at cancer screening, just that preventative service alone, and you can see the difference in access when you compare randomly surveyed people to our SED people. So SED response were far less likely to have had a cancer screening. I'm going to try to move a little quicker just because I know I only have a few more minutes. Access to care is also an issue for our SED respondents. SED residents are more likely to have language barriers, transportation barriers, literacy challenges, experience unfair treatment, lack a personal medical provider, which, as I was saying, is that your gateway to these other services, and lack health insurance. But there are some really positive things to highlight. Our SED residents are also less likely to binge drink, to have substance misuse, to have depressive symptoms, to have experienced trauma, and we measured that through traumatic symptoms. And they're less, I don't know if this is a positive thing or not, but I think you need to dig deeper for the root cause, less likely to abstain from usual activities due to poor health or mental health. That could just mean they're pushing through. I don't know. However, they were more likely to be overweight or obese. And this wouldn't be a robust data presentation if we weren't to highlight the impact that COVID-19 had on our economy. And this is just nice quantitative data to show the impact of COVID. So go to the next slide, Christina. So again, green is 2017, blue is 2021, just the randomized sample. So economic hardships were much more common in 2021 than in 2017. Again, that economic hardships an aggregate of a lot of questions related to finance. More people had lost their insurance in the past year, and more people were unable to afford medical care. A positive of this is a lot of people ate at home. We want to highlight some positive in all of these. And this is looking at our SED respondents. So the blue are randomized, purple are SED. Our SED respondents are more significantly impacted by COVID than the population overall. And I think we all know this. This just shows it with numbers. SED residents were more likely to experience economic hardship, lack health insurance, have an inability to afford medical care, and were more likely to have experienced severe stress due to the loss of a loved one. Okay, I have a lot more data I could share. You can disaggregate the around 80 questions a lot of different ways. So we will be finalizing our formal needs assessment this fall. The content has already been with marketing. We're trying to make it really pretty. So we got marketing support. And that'll be up on our website. I'll push it out through the collaborative, I'm sure, once it's finalized. And then once that's out, and that'll have all of the data, that'll have state, like California respondents, Nevada respondents, Sierra Community House respondents, randomized respondents. There's a lot of different ways you can view the data. We also include in the bigger report the California Healthy Kids Survey data that Kim Bradley reported on a couple months ago. And we include county health rankings data that ranks our counties in California as far as how healthy they are on a lot of different indicators. So it's not just this survey and these two surveys, we pull from a lot of other sources. And once we have that finalized, we will work with the community to develop a community health improvement plan that has really smart objectives that we can measure in 2 years when we do this again. So I'm happy to answer any questions.
Thank you, Lizzie. So we have about 9 minutes for questions. And so Kat has a question in the chat box, Lizzie. So for those not having a primary care provider, were the reasons asked? So for example, are there enough primary care providers at Tahoe Forest to support the community at the moment? Also, do all primary care providers at Tahoe Forest accept Medi-Cal?
Yes, we accept Medi-Cal throughout Tahoe Forest Health System for all of our service lines. There are some services we don't accept any insurance for, like nutrition consults, which are cash pay, but overall, yes. If a provider is not accepting Medi-Cal for some reason, they might have started seeing patients and be new before their credentialing with the state is finished, but I've never heard of that happening. All of our providers accept Medi-Cal. And what was the other one? What are the reasons?
Yes.
Why they don't have a PCP? I don't think we asked why. We do ask why for some questions, such as why did you not get your colonoscopy and why did you not get your flu shot? We haven't asked in this question, in this survey, why do you not have a PCP? You really want the survey to stay around 20 minutes, which is around 70 some questions. And so we try to be really succinct where we can be. But we are bringing on new primary care providers. I know a new one just started and he has a public health background as well, which I always appreciate. So the new providers have open panels and you should be able to get in with a new PCP.
Great, thank you, Lizzie.
Mm-hmm.
So any other questions? You can either raise your hand physically or virtually or drop it in the chat box. So there's a question from River in the chat box. Do we have a list of behavioral health providers who accept Medicare for seniors on the behavioral health provider list from Tahoe Forest Hospital?
So on the Truckee North Tahoe mental health provider directory, it does ask what insurances the independent providers accept. And so it'd be listed on there if they take Medicare. I know Stacy Stahl took Medicare for a while. And there are a couple others, but there has been turnover. So I'd refer to that provider directory as needed. And we have a really passive way to update that directory. You can scroll up to the top, Christina. See the hyperlink that says, please submit your information here. I know it's kind of small, but it says A to Z. Yeah. I have found this to be quite helpful. I get a new entry every month. I have for now the last 5 months received a new entry. So I feel reassured that people are submitting their updates through just that little link. It's really helpful. But under payment, you can see like Anna Jari, for example, it says private pay, sliding scale based on, I can't read any further, but if you were to put Medicare and if you go under payment, you can filter by different insurance companies. And you can see Medicare's on there.
Thank you, Lizzie. And then Christina dropped the link to the database in the chat box.
Yeah, apply.
Okay, any other questions for Lizzie? We have a few more minutes.
I just want to say thank you to Sierra Community House for partnering with us. It provides such profound data, and it's really helping us drive through some initiatives with our board and our administration. So yeah, it was just a really great partnership.
Great, thank you, Lizzie. Any other questions? Okay, well, thank you, Lizzie. That was a great presentation. I really appreciated how concise the information was. I know it's a ton of data to distill down to a handful of slides. It's something we struggle with as a collaborative, and you did it fabulously. And keep us posted as the information continues to come out from the hospital. And again, as partners, I really do encourage you all to use this data for your grant writing, for your fundraising, to inform your work. And we appreciate all the work that you all did to ensure that the data is always up to date and relevant, and that pandemic data is particularly helpful. So thank you.
Yeah, we do have a final executive summary, and I'll drop it in the chat. It is only in English, but it's pretty concise and has a lot of data in there. So I'll just drop that in. Thanks.
Thanks, Lizzie. Okay, we are going to shift gears for the last 25 minutes or so and hear an update from Connecting Point 211. But before we do that, I just wanted to share a quick announcement. So as many of you know, over the past year and a half or so, we have been working with many of you on the call today around developing a COAD. So a COAD stands for Community Organizations Active in Disaster. And COADs play a really critical role in coordinating nonprofit services, community-based organization services, and government services during a disaster, before a disaster, after disaster. And we learned during COVID that many communities across California have COADs in place to support this integration of community and government services. And so over the last year and a half, like I said, we've been working on developing a COAD blueprint to really provide us with a plan moving forward around how we could develop this integration locally. And one of the key recommendations was to hire a COAD coordinator. So we have been working closely with our partners over the past 6 months to figure out that structure. We are thrilled to share, and I think I've shared this with you before, that Connecting Point has agreed and is thrilled to be housing our COAD coordinator, and that a COAD coordinator was recently hired, or a COAD manager. So I wanted to share with you all that Ann Rarick is the new COAD manager. And Ann has been the director of hunger relief at Sierra Community House for the last several years. And I wanted to turn it over to Teresa Crimmins, who is a deputy executive director of Sierra Community House, to share a little bit more as well. So we're thrilled for you, Ann. It's all you, Teresa.
Thanks, Allison. Hi, Ann. I just wanted to say how a big thank you and a big acknowledgement to Ann from Sierra Community House. Over the past 8 years, she's provided support and leadership for the hunger relief program and for our agency, both at Sierra Community House and Project Mana before that. So just a huge, huge thank you. We are thrilled for you, Ann, and we are thrilled for all of us to have Ann in this really critical role for our community and our region. And then one last thing, we're hiring. So if you know anybody who would be good for the director of hunger relief position, let me know. Check our website for the listing and all that good stuff. And I'll turn things back over to Allison.
Thank you, Teresa. And we will hear more from you at an upcoming meeting as well, but we're really happy for you. All right, so I'm going to turn it over to Tiffany Lombardi, who is the resource specialist with Connecting Point 211. And thank you for giving us an update on all the good work you're doing.
Thank you. So I'm going to share my screen in just a moment. Hold on a sec. Can everyone see my screen?
Yes, it's in like the non-presentation mode, but we can definitely see your screen.
Oh, okay. Let me see if I can fix that.
It's great.
Can you
You
see
got
it now?
Yep, perfect.
No, sorry, that was the Spanish. I have to share after her.
Oh. Okay,
So
sorry.
try
just
again.
bear with me a moment. Okay. Is it working now?
That's it.
Okay, great. All right. Well, hello. My name is Tiffany Lombardi, and I am a resource specialist at Connecting Point. And today I'm giving you an overview on 211, which is a program of Connecting Point. So I will begin the slides. Okay. So 211 is a 24-hour contact center that's available 365 days of the year. And people are able to receive multilingual information and referrals through us. So this slide shows a little bit of information on what INR is. These are services which can assist any person in locating or using available and appropriate resources in their community. So based on where they are and what their needs are, this will help them to get more acquainted with the information that's out there and what they can receive as far as services. And information and referral is also provided by nonprofits, libraries, community-based organizations, or government agencies. And INR providers create and maintain resource databases of programs and services in the communities that they serve. So here at Connecting Point, for our 211 team, we have our own resource database. It's maintained by our Connecting Point resources team, which is myself and also my colleague, Susan Sanford. We have resources serving Placer County, Nevada County, and the Tahoe Truckee area. So this includes resources at the national level, statewide level, through the county, the cities, and then just, based on their location, anything that's serving that area. We have a total of 3,412 database records. This includes agencies, this includes their programs, which are the services that they provide, and this includes site records, which are the locations where those services are offered. And we also provide referrals and services for additional basic needs. So this can be providing referrals to our navigators to help people to get set up with or learn information on CalFresh, Medi-Cal, and senior assistance as well. So senior resources so that they can have access specifically for those sort of needs. We operate a COVID-19 call center for Nevada and Placer counties. So anything that's COVID related, whether that be getting vaccines, getting boosters, finding information if they lost their card, really anything along the nature of, COVID. We also have a Ready to Grow program. This is a partnership between Connecting Point and First 5 Nevada County. And this is specifically for Nevada County residents. It's referrals to navigators for ages and stages questionnaire to help screen for developmental delays, and also to provide information and referrals to family members, including parents, guardians, caregivers, as well as childcare providers. So this would be information on programs and services that support the health and well-being of children who are ages 0 to 5. We also have a mobility management program. And this is a partnership between Connecting Point and Caltrans. And currently this
Oh,
covers
Go lay down.
and currently this covers all of Placer County and Nevada County. And there are discussions for this program to expand to cover Capital City Corridor, which would include Sacramento County. And the intention of this program is to provide information on local and regional transportation resources, including bus routes and schedules, paratransit services, ride sharing, delivery services, taxis, hiking and biking trails, and the online tools that people can access. This offers individual trip planning assistance. So this includes step-by-step instructions on how to get to a destination. And it's primarily targeted to help seniors or people with special needs or disabilities to learn how to safely and independently use public transportation. However, it is also available to anyone in Nevada and Placer counties. We also have our Kick It California tobacco cessation program. This one is to be able to help people to quit tobacco use, or at least get on the journey for that. And this includes us during our initial phone call with folks. We ask them if they currently use tobacco, and if they would like to, if they would like to participate in a survey. And participation in this survey would lead to a phone call for like a counseling and general information about, how to quit tobacco use. And in completing this, they would be able to receive a gift card for $25. So, and then also I've heard really good things about it. One of my coworkers did participate, and they said that there was a lot of assistance offered as far as if you need nicotine patches, whatever it is that you might be needing throughout that struggle. So just to be able to get back on to a more like clean way of being. So I'm going to move to the next slide. We also provide housing and homelessness assistance through 211. So we are the coordinated entry provider for both Nevada and Placer counties. We do have some stats up here on the screen for you that we completed 3,372 coordinated entries in 2021, so last year. During that process, what we do is it's a little bit, I would say, in depth. We go through the caller situation. We find out what it is their needs are, whether that might be referrals to emergency shelter, whether they would like to get on a long-term wait list for more permanent housing, whatever their housing needs are, and that can vary based on individuals or families. So we help to get them referred to the right people, get them set up so that they have shelter for the night, or get them, case management assistance so that they have that ongoing case management. Whatever the referrals might be, that's how we try to help in that way. There's also housing provider and case manager referrals. So what that is housing providers and case managers are able to complete coordinated entries with their clients, and then they're able to send that information over to us, and then we input it and get them started in the system. So in the HMIS system, which is Homeless Management Information System. We also are, sorry, I can't see the top of my slide, but we are also open for disaster, public safety power shutoffs, and public safety outage management events. So that's what the PSPS and the PSOM stands for. We are the disaster call center for both Placer and Nevada counties, and we complete public safety outage management screenings for disaster and for disability access and resources referrals to Freed for Nevada County, and also during some events for Placer County as well. And then there's also, of course, PERS in Placer County. And then we also assist with preparedness, active response, and recovery resources. So This can include referrals to the emergency alert services, which would be code red for all of Nevada County, Placer alerts for all of Placer County. And we are able to assist in the sign up of code red alerts. However, Placer alerts, we point people to the information to be able to sign themselves up, just because this is an emergency alert service where they need to create their own accounts. So we do provide the information for Placer alerts, and we're able to provide information and, if needed, assistance to be able to sign up for the code red referrals. And let's see. There's also the Get Help Placer text campaign, which Katie spoke on a bit earlier. And there should be the link in the chat. And if not, I will provide that in the chat. And this is for community partners and 211 Placer beginning a new tech subscription line. So this is to promote social service programs and events throughout the year. So I know a lot of people were sharing earlier about the services that are going on, and that would be a great opportunity to be able to expand your reach. So these push texts would be available in English and Spanish. And to enroll, you can text Get Help Placer to 898211 for English, or Ayuda Comunitaria for Espanol. And I'm sorry if I didn't pronounce that correct. I'm not a fluent Espanol speaker, so I do apologize. But the text campaign will be running throughout the year. And if you're interested in promoting your program or events, you can complete a survey that we have linked in the chat. And then this slide is a bit of stats, a bit of statistics for Tahoe Truckee area. In 2022 to date, we have received 650 211 calls from the Tahoe Truckee area. The top needs from people that have been calling in have been for housing, healthcare, and utility assistance. And the top referred resources would be for coordinated entry, which we spoke about earlier for housing and homelessness, Sierra Community House, as well as the Tahoe Forest Hospital. And this is the end of my presentation, and this is just to remind you folks to connect with us, that we are available 24 hours, 365 days of the year. We do have fluent Spanish speaking staff, so se habla español. We do have the ability for people to text their zip code to 898211 or to dial 211 from their phone. And of course, there's the non-short code, the full length phone number of 833 dial 211. You can also get resources on our website for 211connectingpoint.org. And we're happy to be able to update any resources that you may have already with us. So information on your agency, on the services you provide, and your locations, just reach out at any time. We're available. And I will leave my contact information in the chat. And if you have any questions, feel free to reach out or feel free to ask. And that's all.
Great. Thank you so much, Tiffany. It was really helpful to hear the in-depth overview of your services and to see the Tahoe Truckee stats in particular and what the top needs are. So thank you. So any questions for Tiffany? You can raise your hand virtually or physically, or put it in the chat box. Okay, well, I see no questions. So thank you again for the information. And I guess I would just say in closing to this part of the agenda, and Lindsay, I do see your hand raised. I really encourage everyone on the call and share with your coworkers or your organizations to help push out the 211 information. It really, like Tiffany said, is our main information and referral organization and resource as a community. And like the more we keep our information updated as organizations and as a collaborative, the more effective it can be as a community. So thank you for that. So Lindsay, I do see your hand up.
Yeah, excuse me. I just wanted to mention, first of all, Tiffany, great job with the presentation. I did post in the chat the link to the survey. So if you want to promote your program or your event, just follow that link and complete the survey and click submit, and we will get your program in one of our text blasts.
Thanks, Lindsay. And Christina, I see your hand raised.
Hi, there's a message from Jasmine in the chat that the Spanish translation is unstable, which I think she means interpretation. So I'm just gonna end it and then start it again to see if that helps.
Okay, thank you for the heads up.
Okay, thanks.
Okay. Okay, any other questions for Lindsay?
Lindsay, this is Katie. There's a 211 specific brochure too, or I'm sorry, Tahoe Truckee specific brochure too that exists, right? I'm trying to remember.
I'm sorry, can you repeat that question?
There's a Tahoe Truckee branded brochure that exists too, right?
Yeah.
Okay, I just want to make sure. Should I link to that ordering form in the chat too?
Absolutely. Thanks, Katie.
That would be great. It comes up often as far as like local Tahoe Truckee resources specifically, and especially pamphlets. And as a collaborative, we spent a lot of time creating specific pamphlets and updating them. So that's great that there's one available through you all as well.
Yeah. And I just have one extra reminder, and that is, I know Tiffany touched on this in her presentation, but you know, as everyone knows, in Truckee, you guys recently switched to Code Red. And so we are happy to do Code Red signups for folks who haven't been transitioned over yet.
Okay.
And they can do so by just calling 211. We'll get them enrolled.
Okay. And then the question from Natalie, is there a get the Placer text available or get help Placer text available for Nevada County?
Yeah, you know, the difference with that is the Placer alert messages. I'm sorry, rephrase, or if you could rephrase that question for me.
Is the Nevada County
I think the question is like, is that form available for Nevada County as well? Is that
So it's technically for organizations that are you know, serving Placer County. But I think we probably could do it, and Katie, if you're still here, correct me if I'm wrong, we could probably do it for programs that serve both counties. And I know the Tahoe Truckee area being very unique, we do have folks who, you know, Nevada County programs and Placer County programs that may apply to certain areas in the Tahoe Truckee area. So again, Katie, correct me if I'm wrong, but we can include Nevada County resources that cover Placer. Is that right?
So Katie's response, sorry, this computer just slowed down as well. As long as programs can serve Placer residents, they can be located in Nevada County.
Perfect.
Okay,
Yep.
cool. Great question, Natalie. Thank you. Okay, well, thank you again, 211 team. And we look forward to hearing more updates from you in the future and really appreciate all the good work you do to support our community. So with that, Christina, we're going to go ahead and close. So if you wouldn't mind sharing the slide deck again, Christina, and if you want to explain the Mentimeter, that would be really helpful. And then I will close us out as folks fill out the evaluation form.
Sure. So a way for us, whoops, that did not work. Sorry, I had it copied and now I need to undo this. Sorry. In order to get your feedback, we're using a platform called Mentimeter. And so you can use your camera and just hold it up to this QR code and it will open the feedback form. So you don't even have to take a picture. You just hold the camera up to it. Or you can click on the link I just put in the chat, and that will take you to our feedback form. And I'm going to give people just a few seconds to start filling it out, and then I'll show you our responses. You can also just go to menti.com and type in the code 44151445. And you can see people have already started filling it out, so thank you. I'm going to give you just about 10 more seconds to fill out this question, and then we're going to go on to the next question.
And this is another tool that we'd be happy to share with you all. Many of you participated in the facilitation training the Community Foundation hosted, and we learned about this tool there. So it's proven to be very helpful for us as a collaborative and as staff in particular, for sure.
And I'll stop sharing.
Okay.
But now it should have advanced to the next question. So we always appreciate your feedback. So please leave us any additional comments or feedback.
And then in closing, one of the things that we have learned from some of the guides and mentors and leaders in this field is to really work like proactively towards embracing joy, and just recognizing that the work that you all do as organizations and that we do as a collaborative and as a collective can be very challenging at times. And I know it's been a particularly challenging month as a community. And so this is a quote that we found by Henry J.M. Newen that says, "Joy does not simply happen to us. We have to choose joy and keep choosing it every day." So we've committed to ending our virtual resource sharing meetings with a video that we feel like embraces joy. If you have one that you would like to share with us that we can share with you all, we are welcome to any and all joy videos. And so Christina, I will ask you to share your video as folks start signing off from the meeting. And thank you all for being with us today. Thank you all for the good work that you're doing.